we were seeing double-digit response rates. And I mean, like in the 20, 30 percentile, you would normally see like a 6 or 7% response rate. That's monumental. Hi, my name is Denatras Silas. I'm the Chief Information Officer here at MedCura Health, located right outside of Atlanta, Georgia. All right, so some of the challenges that led us to working with and reaching out to HealthTalk were, of course, with engaging our patient base in the most optimal way. Some of the bumps in the road that we had faced with other solutions, of course, were throttling, I guess you could say. So when we want to send out large mass campaign messaging for various things, sometimes we reached a level or limitation of how many people we could reach at a certain time. Some of the other bumps in the road, of course, was also with the user involvement. So my internal people utilizing the system, it required, a lot of heavy engagement and involvement from those people. When I first encountered it, of course, I initially saw that they did the things that we needed them to do, but they did other things, right? We could utilize it for other patient outreach efforts. So for our outreach enablement and our patient enrollment piece, so we could reach out to net new patients, right? And have them enroll into our health system. We could utilize it for our quality care center for reaching out and getting various quality care measures back. We could use it for our referral loop closures. This would allow us to do that, in a low cost, low touch type of solution. The very first thing that we turned on within HealthTalk was the ability for patients to perform reschedules on their own. And being able to see the response rate, being able to see the success rate of that, and being able to see that it was completely hands off from our scheduling team was that early success, right? We were seeing, double-digit response rates. And I mean, like in the 20, 30 percentile of response rates. In comparison to industry standards, where you would normally see like a 6 or 7% response rate, that's monumental. I mean, what that means from a rescheduling perspective is that your grandmother is trying to reschedule her own appointment within elder care. Some of those patients, tend to lean on one of their children or their grandchildren to perform a lot of these reschedules on their behalf. And so what typically ends up happening is they could drop off of that radar, right? Where we're not reaching out to that person that's responsible for helping them assist with their care. And we miss that traditionally. With this, we're able to reach out to this patient via, SMS. We're able to reach out to who's ever, even if there's someone within their health record that says that it helps them assist with their care, we're able to message that individual and they're able to perform these reschedules live on their own without the need of calling in, waiting in a call routing tree, navigating through that, possibly waiting to get online with someone and being able to perform that reschedule, or having someone check, right? They're able to do this all on their own from the comfort of their own living room in the palm of their hands, right then, right there. On the back end for us internally, what that also means is being able to do this through technology. We're able to do that and leverage that cost savings and put it back into actual patient care as opposed to going into administrative overhead. My experience with the HealthTalk team has been phenomenal, to say the least. It's been a partnership. I feel that there's someone in a foxhole with me trying to accomplish these goals that we're doing. And HealthTalk has been right there literally from day one along the way. We expected these challenges. We knew that they would come. We rolled up our sleeves together and we, just hunkered on. My advice to, another CIO on the fence or thinking to make this leap into this type of technology would be to look at how it not only applies to a niche solution or niche problem that you have. My main thing is making sure that I'm able to consolidate my technology so that it can be used for to solve more than one problem. They're forward thinking. They have a product roadmap, of course, and they have certain things that they have that are coming down the pipeline. When, my customer success manager, or even I'll just be real, the CEO, and if he sees something that's on this product roadmap that they see that could possibly meet some niche need that I need within my practice, they'll reach out and they'll let me know that these things there. Again, that's that partnership. They're in this foxhole with me. And so when these new things are on the horizon or these things that they're thinking about, I have agency, right? We have agency as an organization within that conversation, and I love that about them.